I'm Dr. Sana, and today we're talking all things threads. So I found myself quite frustrated recently with a lack of treatments available for achieving lift without surgery and without epic amounts of filler. There's a whole category of people who find themselves in a twilight zone in between surgical need and filler need. For subtle lift and subtle repositioning of tissues, a little bit of filler can go a long way. For some people, the tissues are so lax or so far from their original position that really surgery is the only option for them. But what do you do if you're in this in-between, where surgery feels like too much risk and a bit too scary to pursue, and filler just is not going to give you that result that you want without distorting you, essentially? So what are threads and how do they work? So the kind of threads I'm using are by a brand called Mintlift, and they're made of a material called PDO. PDO threads are essentially threads made of the same material that resorbable sutures are made of. So those are the kind of sutures you may get after certain surgeries that absorb all on their own and don't need removal. The difference with these is that these are very, very cleverly created to also have cogs built into them. And when I say cogs, I mean small little barbs that are able to engage in the tissues and help to reposition and anchor tissues in a new place. Now, often you'll see before and after pictures of thread cases, which are immediately after placement of the thread. And I want to let you know that those are not actually thread before and afters. The immediate after result you see is not the result that you're going to have in the long run. You'll often look a little bit exaggerated, a little bit extra pulled, a little bit extra tight when threads are initially placed, because we are trying to get as much anchorage and as much repositioning as possible for the period of time when the thread is present. The thread actually dissolves completely over time. Over the following 2 to 4 weeks, you'll find that that thread slowly is absorbed by the body, but the important thing is the body's response to that thread. The material PDO helps your body to stimulate collagen and elastin production in this new repositioned tissue place. So when we reposition the tissues, place a material which is a biostimulator, it can lay new collagen and new elastin in this new, tighter, more lifted position. And that result really is visible from about 4 weeks, but you will see it more clearly over the following 2 months. Who is right for a thread lift? We're looking for people really who, when we do this kind of maneuver, we don't need to reposition the tissues more than between 1 to 2.5 centimetres. Now, I don't expect you to know that, that's where the consultation is really important, but really these are the right kinds of people. We're looking for people who are feeling heaviness in their mid-face, feeling heavy smile lines, feeling heavy jowls, feeling heavy jaw lines, but are not looking to add more volume, essentially, because not all cases of sagginess or loss of elasticity are accompanied by a dramatic loss of volume. Threads work really well with other treatments like Botox and fillers and skin boosters. So just because threads might be indicated for you does not mean that these other treatments might not complement them really well as well. If you're interested in learning a little bit more about threads, drop us a message.